So this is, good morning, Mr. Chair and Commissioners. This is showing kind of the trend. As you can see, we keep watching the confirmed cases, and then those no longer needing isolation, deaths, and then active cases. So, you know, we continue to gradually climb, not in huge amounts, but right now, as of June 22nd, we're at 528 confirmed cases, but 474 are no longer needing isolation. So that's great. Right now, the active cases are 17. Now, sometimes these numbers change. So if you think about last week, some of the confirmed cases, the numbers may be a bit different, and it's just that the state catches up in recording those numbers. So, you know, it's great that we're not seeing some of the huge surges, but and the deaths are kind of staying at 37, as you can see. So we haven't had increase in deaths. The deaths that we've had in Clay County, out of the 37, 15 of those were in their age group of 90 to 100. 13 of those were in the 70s and 80s, and 9 of those in the 50s and 60s. So you can see there's a little bit of a age range in those deaths in Clay County, at least. So you know, it's kind of somewhat maintaining. And then you see the graph. It just is a graph that's showing total cases and patients no longer needing isolation. So that's good. The hospitals are not overtaxed again, as we've talked about for a long time. They haven't had that experience here in our metro area. So ICU beds and hospital beds have been available to the people that need them. It's different, of course, as you watch the national news. It's a bit different now as we're seeing some of those trends in some of the southwestern states. You see Florida, Arizona, Oregon, some of those places that they're seeing a huge increase. Percentage of increase is really ramping up. Some of that, just the health experts are saying it is not completely attributed to increased testing. That's just a small factor, but more so about people really less adherence to the public health practices of wearing a mask and social distancing. So they're seeing more of a relaxation of that in some of those southern states, particularly since Memorial Day. You saw a lot of events where people were not social distancing. So they're still following that, but they're attributing that to really that lax in the virus. The message is the virus is still around. It has not gone away. It's still highly infectious. So maybe that's part of why they're seeing that ramp up. We're not seeing that right now. We do anticipate that we're going to see probably a ramp up in the fall. So as I talked with the Commissioner of Health yesterday, they're really planning for that we're going to see another increase with you know, with influenza season, of course, in the fall, and then with COVID, and we won't have a vaccine. They still aren't anticipating the vaccine to be available till 2021. So with a vaccine, you know, we could get that herd immunity with, you know, 60 to 70% getting immunized, just like influenza. But it's going to be a tough fall, is how she described it, with influenza circulating, COVID circulating. We're going to see all of the students coming back to all of the campuses, and they're still looking at kind of scenarios of what they're going to do as far as the students staying in dorms, how they're going to social distance the students, requiring masks in the classroom. I know North Dakota is going to require testing of every student before they come back. And again, that's just a point prevalence test, so it'll just tell them that day if that student has COVID. It doesn't mean they could get it in a week, but it may stop some of those positives for some of the students carrying that at that time, and then they'll have to you know, do the isolation and quarantine. So they're planning for all that. I'm not sure. Minnesota is still talking about what they're going to do with testing students, so we've been bringing that up. Is there going to be testing of every student before they come back to MSUM and Concordia, or is there not? So So more of that to come. We're still not seeing the, 14-day case decline, so we can't really say that we're at the end of the phase yet in Minnesota. So we're still watching those numbers. And then, of course, planning for the fall. We're anticipating, as the Commissioner of Health has told us, we're anticipating it to be pretty significant. So that doesn't seem so far away when we talk about how campuses will be opening up in a couple of months. So we're really going to anticipate how that's going to look. So watching the numbers, watching what's happening across the United States. We do actually have finally got a percent of tests by county. And so Minnesota put that out, but we're not exactly sure about how that fits in with Clay County because of the testing on the North Dakota side. So if all the negative tests are actually counted on the Minnesota side, so far it says there's been 7,200 tests in Clay County, but again, that number may be variable based on the negative tests that they may are not counting that have happened on the North Dakota side. So it still shows we have an 8.6% positivity rate, and again, not quite sure about that number either, but at least they're kind of looking at some of the models, and more information will come as we're watching that. Our median age of positive cases, again, is 46, as I've described the ages of deaths, but the median age of positive cases in Clay County is 46. In Minnesota, it's actually 40. Now, they are saying they're also seeing a number of younger people getting COVID, and some of that is just, again, they're attributing it to, maybe being out there and we're sick of wearing masks, we're sick of social distancing, so it might be more, the behavior. But COVID is here. We're probably all sick of hearing about it, and we're all sick of hearing about wearing masks and social distancing, but that's the only thing we have right now to kind of keep people from becoming ill, and definitely want to make sure we, deaths, every death is a sad thing, so we want to keep the deaths down. And of course, not create a surge for our hospital system. That's really been good that we haven't created that in our communities yet. Any questions?
Mr. Chair, I have a question. Kathy, the positive cases were showing 528. Patients no longer needing isolation is 474. There's a difference of 54 there. Why is that different than active cases of 17?
The deaths. Yeah, the deaths in there, correct.
Okay. Okay, I see there, okay.
Yeah. Sorry, I should have described that, but yeah, that's it.
Well, I guess if I would have done my math, I could have.
So that's really good when you think about 17 cases that are active that we're following. That's really a nice.
And those 17, there's contact tracing going on with those?
Correct, yes. And we're able to keep up with that. Minnesota has, as of last week, said they've really caught up and are now managing, because they hired a lot of people with Minnesota Department of Health, but also Public Health. We have about 5 people doing contact tracing, but we can't keep them busy because we just don't have the numbers right now. So they're seeing just a handful of people. So that's good, but we want to keep them in place because we know in the fall we're going to see a pretty increased need for case investigation and contact tracing.
How does this compare? Have you been able to compare this with Cass County?
Yeah, Cass County, Cass County has, of course, been their hot spot, but they're really doing a lot of testing, and their contact tracing has been reduced. They're seeing less, so they have less people actually. They're
just across the river, that's what
yes, exactly. And we have a Minnesota subgroup from the Red River Valley Task Force, so we're meeting with the epidemiologists from the North Dakota Department of Health and our Minnesota Department of Health people, and then our local public health. So we're able to continue to talk through some of that, the cases, and as we are sharing information, because we know that Minnesota cases are sometimes being caught in the North Dakota system, so we're able to tweeze those out. And the person that is in charge of my case investigation and contact tracing is in regular communication with the epidemiologist from North Dakota Department of Health, so we're able to keep up with that.
And one final question, is there gonna be a major effort on educating for the flu shot this fall and getting it soon?
Yes, we're really going to push that. That's part of the mission for Minnesota Department of Health and local public health. We really want to push people to get the flu shot, and you know how that goes when it's seasonal. Sometimes people get a little lax about getting that vaccine, but that'll be really critical, especially when we'll have 2 viruses circulating and no vaccine this fall is anticipated for COVID. So,
Have they determined what strain of flu they're anticipating then this?
you know, I haven't heard what the anticipation is. We probably will hear more about that, but we do have a flu vaccine. We have vaccine on order, so
Okay.
we put that in quite a while back. So we probably will expect more people getting the flu vaccine. That's what I would anticipate. But again, it won't protect you from COVID. That's a
Right.
different vaccine, but at least, you know, when you got 2 viruses and both pretty significant viruses, you definitely at least want to get protected from the one that we have a vaccine for. And then hope that that vaccine for COVID comes earlier in 2021. So challenges ahead for sure. No more Wednesday press briefings either. They've kind of ended those for a while, so we'll see if that ramps up again in the fall.
Well, you and your staff put in a lot of hours on this. Thank you for your
Yeah,
efforts.
it's been crazy, but we're slowing down for a little bit, so that'll be good. Thank you.
I notice on deaths, you know, the deaths are mostly the higher age. But if I look at the cases, most of the cases are from 20 to 40 years old. That's where most of the cases. What is it, I know most cases with the deaths, they say underlying causes and stuff like that. But how do the people from 20 to 40, how are they recovering? Are they going to the hospital? Are they just staying at home and recovering? I mean, how did they recover from the flu that the senior citizens are recovering from the flu?
Most in that age category are able to recover at home. So we're not seeing a need of hospitalizations for the younger
What do they
ages.
do though? Do they take medicine or they just stay at home and that's it?
Yeah, you just stay at home. There really isn't any medicine to take. So in many of them, you see a variety of symptoms from a lot of symptoms to, I talked with one individual in his 20s, and he had actually no symptoms. He could not pinpoint any symptoms that he had, and yet he was positive for COVID. So you see the wide range of mild cough to all of the symptoms they list, but it also depends on your health conditions. So if you have underlying health conditions, it's more challenging to recover.
So when you're saying that that person that you talked to had no symptoms, how did he know he had COVID or did he?
He was in contact with another positive case,
And they checked him and he
and they
had,
checked him, but he had actually no symptoms. That's the first time I talked with someone that actually, he couldn't pinpoint any symptoms. He didn't have body aches, cough, respiratory symptoms at all, so. But he tested positive, so he stayed home for his 10 days, so, yeah.
okay?
Kathy, I have a question in terms of tracking the costs of COVID. I know that we've had discussion early on in terms of how much it was costing us to fight COVID. Do you have a rough estimate where that number stands?
Oh, boy, I absolutely do not. We have a line item specifically for COVID, so all of the staff that are doing any COVID work are in a particular cost center, but I haven't talked with Lori about what the cost is, so I don't even have a...
When you are able to catch your breath, I think it
Sure.
would be helpful for us to understand a little bit
Sure.
about the cost.
Yep, we can do that for
Thank
sure.
you.
We had a little bit of funding from the Minnesota Department of Health, but it's very minimal to cover some of the costs. The governor talked about more funding coming out, but we'll see if that occurs, but
Okay.
we had a little bit, so.
Thank you.
Okay,
All righty,
thank you very much.
thank you.